accidentally dislocated your shoulder and have hypermobility, knowing the right steps is key to a safe recovery. I'll guide you through essential tips to ease pain and support healing. Dislocated and subluxated shoulders are not the same. Dislocation is one step further and beyond subluxation. So if you have dislocated your shoulder, the first thing to do is to pop it back in. This is most often something you are familiar with if you are a hypermobile individual, but best to have it done at the emergency room. So you want to put the joint back in place. If you want to take medication, it's okay too. So this is the joint, that's the arm ball inside the socket, and that's exactly when you have a dislocation, it just pops out of the socket. So taking medication, of course, is okay, as far as I know. I like taping the area for better support, which is what I do in the direction of most relief. Then start working on connecting the arm with the neck and shoulder blade, which is so important. So that connection has to happen. It's a better positioning of the joint. So your shoulder blade is provided, the socket is provided by the shoulder blade. So this is a ball and socket joint, and so positioning of your shoulder blade is important. So we want to position it better in exercises that don't isolate the area, but work on group strengthening. Group strengthening means the ball, socket, neck, and mid-back. So what exercises? These are developmental exercises, which are the baby exercises. We've all done these exercises as we developed our movement as babies. They are low impact on the joint and provide the most amount of cooperation and collaboration of the body parts involved in the movement, of course. It all depends on the person and the history. So what I'm about to show you may not be the progression of move for your case of dislocated shoulder. Everyone's different, their level of dislocation is different, their level of injuries are different. All of those play a role. So when we do developmental exercises, what's basic and intermediate and advanced for one person may not be the same in other people. So we want to start with first getting the arm to know what role it has to play in shoulder movement, and that is what we all did at age 6 weeks of age. That's tummy time. So we're going to be doing tummy time. So let's do this together. Placing your elbows by the crease of your ears, and you're going to go on your forehead. You're going to first lift the forehead and your head up. Press on the inside of your elbows. Just go ahead and touch the inside of your elbows. There's a bone there. So you want to press down, which in turn will lift the arm slightly up, and then you want to send it towards your back pocket, just kind of going diagonally down towards the lower back area. So it's going to look like this. Forehead up, pressing on the elbows, sending the shoulder blades back. And then somewhere on the top portion of your mid-back is when you need to start feeling the muscles activating and gliding your neck up. And then you hold it there. So important. This is what you did at age 6 weeks. That's the first mini concert your body played, which is so important. We want to make sure the right things are connected and the right things are activated and initiating the move. With hypermobility, I see that disconnection quite a bit. So we want to go back and do the very first exercise we all did to get the right body parts activated, which is important for your healthy shoulder positioning. The next one is what we all did at age 5 months with activating our arms, which is so important. So now the arms connecting to the shoulder blade, and we are just rotating into it. So it's going to look like this. You're going to be having your arms up, spine's nice and neutral. You're breathing your sides out, breathing biologically. You're going to keep the rectangle rectangular. And as you're rotating, I'm rotating towards the camera. I'm going to press this part of my arm into the ground and keep rotating. When the rotation happens, there is this gap in my body. That gap between my body and the ground is not because the top pulls me up, but it's because I'm not collapsed onto my shoulder. Did you see that? I collapsed into my shoulder, whereas I'm activating, like I'm trying to pull my shoulder blade towards the back wall and press the top of my arm into the ground. And that's what we all did at age 5 months, just like that. The next one is what you did at age 3 months, when it was a late phase of your 3 months. So once again, you're going to go on your tummy, placing your hands under your shoulders. You're going to push the elbows, like think about your elbows going towards the floor and towards the back wall. And you're pressing the ground with this part of your hand. And it's as if you're trying to do this to the ground. So you're trying to go down deeper into the ground and pushing yourself up. Only you're not using your upper trap to lift you up like that. Like this, you're not doing that. You're going to the side, pushing the ground, elbows going towards the back wall and towards the ground. And you're not looking up, you're not looking down. The head is slightly looking up, the neck is gliding back, and you're just holding that in place. You should not be activating and clenching your butt in the process. This is all your neck, upper back, mid back, and your arms that are working. If you are hypermobile and are ready to take the time to understand what your tendencies are, what to replace the wrong moves with, so you know how to be basically in a good place and minimize your chances of injury and maximize your joint stability, contact me. You know where to find my information. Thanks for subscribing, and until next time, take care.